Number one, people should do a regular amount of exercise. Now, many of us are not addicted to exercise and are become triathletes or marathon runners, but in terms of heart health, if an individual can exercise or do some aerobic activity 30 to 45 minutes a day, 5 days a week, that's great for your heart. Diet's important. We used to think that the cholesterol in eggs and meat were the major problems leading to high cholesterol, but actually we found out that processed carbohydrates are probably the worst thing for our heart and for the tendency for atherosclerosis. By markedly decreasing our dependency on processed carbohydrates, and what does this include? Well, all the things that we have learned to enjoy in life. Desserts, ice cream, breads, pasta, rice, all these crackers, popcorn, all the things that we sometimes look forward to or are the comfort foods are actually the ones that lead most to a change in your lipid profile and an increased risk for atherosclerosis. Other things to remain heart healthy: smoking cessation. Smoking is not good, and for a number of reasons, but certainly it correlates with a significant increase of heart attacks and vascular problems. We sometimes try and simplify things and say, well, look, there's cholesterol plaque that builds up in the arteries. It must be diet, exercise, high blood pressure, all these classic risk factors. But interestingly, when we've done some classic studies to look at correlation of gum disease and heart disease, there is a higher incidence. And years ago, when we were actually fixing some of the arteries by removing some of the plaque, we actually stained the plaques for various types of organisms, and it was found that certain types of bacteria and signs of bacteria were in the plaque, and these were bacteria that were commonly found in decaying teeth and people that have gum disease. So that's where this correlation, that's where we think that maybe that it's not that simple, and that people that have chronic infection or problems in their teeth have certain mild bacterial infections or other responses that gets into the plaque and maybe cause the plaque in the coronary arteries to change and increase the risk of coronary problems and narrowing of the arteries and subsequent heart attacks.